Simply, Go Slow Whoa is a nutrition education program constructed around an age-appropriate metaphor to teach elementary school children how to categorize school food into go foods, foods that they can eat all the time, slow foods, foods that they can eat sometimes, and whoa foods, foods that they should eat on special occasions. To scale the program and reach 258 schools and 110,000 elementary school students, representing 25% of Colorado's school population, within a 3-year period, LiveWell Colorado needs $1.4 million in in-kind and cash contributions to scale this effort. Obesity is a health issue, no doubt about it. It leads to chronic diseases such as high blood pressure, diabetes, heart disease, and certain cancers. It's a cause of death. In Colorado, we spend just under $900 million in medical-related costs related to obesity. In Colorado, we're technically known as a lean state. However, 55% of our population is overweight or obese, and it's increased by 55% since 1995. For kids, our situation is much worse. We slid from a national rank of 3rd place to 23rd in the last 3 years. 1 in 4 children in our state is overweight and obese, and we have the 2nd fastest growing obesity rate in the country. Culture change will take a while. It's our job to drive that change, to motivate people to make healthy choices, and through the effect of policy and environmental change, create more opportunities for people to make the healthy choice, the right choice, in the places we live, work, learn, and play. Through strategic, statewide convergence effort, we create a culture where the healthy choice will be the easy choice. You can see here that obesity increases as children go through elementary school, which is the reason why we need to really focus on early stages of elementary school when children are the youngest. Childhood obesity is a more prevalent problem for low-income children who are subject to the social determinants of health that are the leading cause of obesity. Why are we seeing these trends? Because our culture doesn't make the healthy choice the easy choice. These were popular ads once for what we thought were appropriate foods to serve our children. So we've come a long way, but we definitely have a long way to go. This is the current food climate for children. Clearly, the healthy choice is not the easy or the most desirable choice. And even in schools, as you can see by the tray of food in the bottom of the slide, that's typical of what is served in schools today. 40% of children ages 2 through 11 ask their parents if they can go to McDonald's at least once a week. And 15% of preschoolers ask if they can go every day. 84% of parents report taking their young child to a fast food restaurant in the past week. School meals have changed a lot since the 1970s, before processed foods became highly prevalent. School cafeterias today resemble fast food restaurants, where ready-to-serve products are taken out of a box, heated up, and served to children in a repackaged form in an assembly line fashion. The time has come to transform school food and climate. This year, the USDA recognized the role of school lunches in creating obesity and proposed new rules to reduce sodium, increase fruits, vegetables, and multigrain products, minimize trans fats, reduce starchy vegetables, and establish minimum and maximum caloric standards, and serve only non-fat, 1%, or unflavored milks. As we make changes to the school lunch program, how do we get children to make a better choice, a healthy choice? How do we create an environment to make those choices available? LiveWell Colorado works with local schools to implement evidence-based programs And this one in particular was developed by the University of Texas School of Public Health as part of their coordinated approach to the child health program. Go Slow Whoa is designed to increase student and community awareness and consumption of healthy foods to affect childhood obesity over the long term. Our pilot site is Aurora Public Schools, and we've been running the program there for almost 2 years. Aurora Public Schools represents children in Colorado who are most at risk for obesity. 63% of the 37,000 children qualify for free or reduced lunch programs. 50% of the students are Hispanic, and 20% of the students are African American. Why does Go Slow work, and why do we promote it? Go Slow Whoa exemplifies LiveWell Colorado's theory of change and our emphasis on convergence in its approach to changing school culture. By educating children and the adults surrounding them about food choice, partnering with community organizations and businesses, and leveraging resources, the program generates internal demand for healthy foods. We work with KMGH Channel 7 and the Spanish language affiliate Azteca Colorado, as well as the Colorado Rapids, which is a major league soccer team, and the USDA SNAP Ed program. And we create excitement and wider awareness to inspire demand for healthy foods, ultimately improving school foods. Go Slow Whoa is easy to implement. It involves classroom and PE teachers, administrators, and school lunch personnel. It integrates the curriculum into the students' experience, including lively assemblies, classroom posters, colorful signage, cafeteria food, and it's complemented by opportunities for physical activity. So what we try to do is get their attention and make it fun. Its influence is extended through the community on healthy living, sent to parents through announcements that students take home in their backpacks, and popular messages broadcasted on TV. Go Slow Whoa is meant to complement school wellness efforts and not meant to be a standalone program. By changing the environment, policies, and practices within school, students may learn and practice better, healthier behaviors, which in turn will slow the increase in BMI and stabilize the rate of overweight and obesity. By the end of the school year, due to student demand, cafeterias workers reported ordering more healthy fruits and vegetables and less cake. Principals and teachers described the excitement of children as they came up and talked about the new fruits and vegetables that they tried. And we even heard of a mother who reported to a school principal that her daughter had come home and asked for an eggplant, even though they didn't know how to prepare one. Aurora Public Schools saw an increase in recognition and selection in Go Foods and improved attitude toward healthy food choices. The transformation of school environments is evidenced by 6 of the 8 schools that meet the USDA Healthier US Challenge Bronze Award criteria, and also use the USDA SNAP Ed education program curriculum. PE teachers joined with school food managers and made concerted efforts to provide a joint message about the importance of physical activity and healthy eating. Why should we scale it? School food is a key element in reducing childhood obesity, and Colorado's need is high. Nearly 400,000 Colorado children participate in school meal programs. More than 80% of them qualify by income level to receive free and reduced price meals. School food is a major source of nutrition for our children who are most at risk for obesity. Colorado's state is ready. 81% of Coloradans agree and strongly agree that childhood obesity is an issue that needs to be addressed at the state level and that the school environment is part of the solution. Many schools already pursue wellness and nutrition curriculums. The mechanism for scaling the initiative will be an affiliation process where moderate or highly receptive schools and school districts will self-select into the program based on the priority they place on implementing healthy eating and active living, environmental and policy changes. The investment per school is low. It's $5,450. The training requirements, evaluation, and administrative support are not resource intensive. Go Slow Whoa is a turnkey training and implementation program that can adapt and integrate into existing health efforts at schools. Simply, Go So Wo is a program constructed around an age-appropriate metaphor to help school children learn how to eat healthy foods. Thank you.